So this is a 49-year-old female. She presented with about 8 months of pain in the right Achilles tendon. She was status post a laceration / infection to the Achilles tendon prior to seeing me. This ultrasound demonstrates that there is scarring and bulbous type thickening of the Achilles tendon, and she presented with an MRI which we were able to compare to the ultrasound. So this is our patient, 49-year-old female. She got a door that kind of slashed her back in the summer, probably like 8 months ago or something like that. And she had stitches put in at a hospital. Unfortunately, she had an infection. The stitches came loose and she was on antibiotics, and it just drained or healed by itself. We can see the calcaneus on the left side of the screen, which is distal, and we just see this big boggy Achilles tendon. Here's our second clip, and we're just looking at the lateral aspect of the tendon. And now we're just going centrally, and it's just quite thickened, irregular, consistent with scarring and tendinosis. It's just through and through, just thick and boggy, and now we're going up proximally. We could just see the normal tendon coming up. There, that black line is just some artifact. So here you don't want to confuse that artifact for a tear. The Achilles tendon is starting to become normal as you go proximal. And we got the calcaneus in view, and here we are coming up to a thickened, boggy Achilles tendon. You can just see a very thickened, kind of hypoechoic, irregular tendon, especially the superficial part of the posterior part of the tendon. Also, there may be some intrasubstance small tears within this tendon as well, as you can see on this axial view. Above the scar tissue, you can see how it's basically normal type tissue that's thin and thinning out as we go proximal. And as you go proximal, you lose the Caker's fat pair, and soleus starts to come into play with the deep flexors underneath that. And here's just a comparison view to a normal tendon. You can see how it's quite thinner and discrete. And here's that on the left side, the affected tendon, which is very thickened and irregular as a result for a laceration and infection. The point of this video is really to demonstrate how thickened and irregular a chronically scarred Achilles tendon can be.